Could incorporating yogurt into your weekly diet actually reduce your risk of developing type 2 diabetes? This question is more than just a passing curiosity. It touches on a significant public health issue as the rates of type 2 diabetes continue to rise alarmingly. Recent messaging approved by the FDA emphasizes yogurt as a beneficial dietary option, supported by observational studies that suggest a link between regular yogurt consumption and a decreased risk of this chronic disease. In a recent publication in the Journal of Nutrition, researchers presented credible yet somewhat limited scientific evidence that connects the consumption of yogurt with a lower likelihood of developing type 2 diabetes, T2D. This evidence played a crucial role in the FDA's decision in 2024 to endorse a qualified health claim regarding yogurt, suggesting that regular intake may indeed lower the risk of T2D. The FDA's endorsement not only validates yogurt's health benefits but also encourages public health initiatives aimed at promoting yogurt consumption, which can enhance nutrient intake, particularly calcium that is often lacking in many diets. Background on the FDA's review process. The FDA's thorough review process spanned 6 years, beginning with a petition in 2018 that initially included 117 studies. This number eventually expanded to 140 references, culminating in a detailed examination of 28 pivotal studies that informed their final decision in 2024. The urgency of addressing T2D is underscored by its rising prevalence in the United States, which has surged by approximately 20% from 2012 to 2022, now affecting over 12% of adults. This issue is particularly pronounced among non-Hispanic Black individuals and women, highlighting significant health disparities. Worryingly, around 1 in 5 individuals with diabetes, approximately 8.7 million people, remain undiagnosed. Additionally, nearly 98 million Americans are classified as having prediabetes, which significantly heightens their risk of developing diabetes in the future. The progression from prediabetes to diabetes occurs at a rate of 5 to 10% annually, making early intervention critical. Social and environmental factors such as poverty, food insecurity, and limited access to healthcare exacerbate these disparities. The financial implications are staggering, with diabetes-related healthcare costs accounting for about a quarter of total U.S. healthcare spending, amounting to over $400 billion in 2022. Research indicates that lifestyle modifications, including dietary changes, weight management, and regular physical activity, can significantly mitigate the risk of developing diabetes, as evidenced by findings from the Diabetes Prevention Program. However, there remains a pressing need for more accessible and practical dietary guidance that consumers can easily follow. Initiatives that promote food-based recommendations, particularly those that align with the concept of food as medicine, can effectively translate scientific research into actionable dietary choices. The role of yogurt in diabetes prevention. In the context of rising T2D rates, yogurt emerges as a noteworthy food linked to a lower risk of developing this condition. The FDA's 2024 approval of a qualified health claim reinforces yogurt's role in public health messaging aimed at fostering healthier eating habits and reducing the risk of type 2 diabetes. When it comes to yogurt consumption, the amount matters significantly. Research indicates that specific intake levels are associated with meaningful risk reductions. For instance, consuming at least 2 servings of yogurt per week in the U.S., approximately 120 grams per day of low-fat yogurt in Iran, and around 45 grams per day of whole milk yogurt in Spain have all shown beneficial effects. The evidence supporting the health claim is robust, with numerous studies demonstrating that diet, physical activity, and weight management can substantially lower the risk of T2D. However, the availability of consumer-friendly dietary guidance remains limited. Within the framework of food is medicine, yogurt has emerged as a promising dietary option, bolstered by research that links its consumption to a decreased risk of diabetes. The FDA's 2024 qualified health claim states that eating yogurt regularly, at least 2 cups, 3 servings per week may reduce the risk of T2D according to limited scientific evidence. This claim applies to all yogurt products that meet the FDA's standards of identity, including drinkable varieties. To support such claims, the FDA meticulously reviews scientific documentation, conducts independent literature searches, and evaluates only well-designed human studies that meet stringent criteria. The quality of evidence is categorized as high, moderate, or low, based on factors such as study design, relevance to the population, and statistical robustness. Products that utilize this claim must also adhere to the FDA's disqualifying nutrient thresholds concerning fat, saturated fat, cholesterol, and sodium content. The petition submitted in 2018 included 117 references, which were later expanded to 140. After a comprehensive review, the FDA identified 28 observational studies as sufficiently rigorous, encompassing over 860,000 participants from various countries. Understanding the evidence behind yogurt's benefits. Interestingly, yogurt's natural acidity may play a crucial yet often overlooked role in its health benefits. Beyond its rich nutrient profile and probiotic content, researchers propose that yogurt's unique acidic nature could enhance the body's ability to absorb essential nutrients. In a review of 9 high-quality prospective cohort studies, researchers consistently found that higher yogurt consumption is linked to a significantly lower risk of T2D, with reductions ranging from 11% to 40%. Major U.S. cohorts, including the Nurses' Health Studies and the Health Professionals Follow-Up Study, have repeatedly shown that individuals who consume at least 2 servings of yogurt weekly experience a reduced risk of developing diabetes. Similar trends have been observed in studies conducted in Spain and Iran, where substituting yogurt for other dairy products, such as cheese, was associated with a risk reduction of approximately 16%. While some studies indicated variations based on gender or the type of yogurt consumed, low-fat versus whole-fat, the overall findings consistently support yogurt's protective role against diabetes. Several mechanisms may account for these positive outcomes. Yogurt is a source of vital nutrients, including B vitamins, which have been linked to a lower risk of diabetes. The fermentation process enhances the bioavailability of these nutrients, while probiotics and byproducts of fermentation may promote gut health and reduce inflammation, both of which are crucial for improving insulin sensitivity. Increasing yogurt consumption in the U.S. Despite its health benefits, many consumers find plain yogurt lacking in flavor. The research suggests that taste is the primary motivator for yogurt consumption, and health professionals can play a pivotal role in helping individuals enjoy plain, low-sugar yogurt by creatively incorporating it into various recipes and meals. As the prevalence of T2D and other lifestyle-related diseases, national surveys reveal that merely 6% of children and 5% of adults regularly include yogurt in their diets, and only about 12.5% of Americans meet the recommended dairy intake levels overall. Given that yogurt already enjoys positive associations, such as health benefits, taste, and probiotic content, public health communications can effectively leverage these perceptions to promote yogurt's role in reducing the risk of type 2 diabetes. Nutritionally, yogurt is a rich source of calcium, B vitamins, potassium, and sometimes vitamin D, along with protein that aids in satiety, muscle maintenance, and bone health. It is generally low in sodium and not a significant source of added sugars, although it is crucial to emphasize the importance of choosing plain or low-no added sugar options to align with dietary guidelines. Consumers are increasingly receptive to food-based health solutions, with many individuals seeking to enhance their energy levels, manage their weight, or prevent chronic diseases through a balanced diet. Taste remains the foremost motivator for yogurt consumption, presenting opportunities to highlight its versatility in meals and snacks. Health professionals, as trusted sources of information, can assist individuals in incorporating yogurt into culturally relevant dietary patterns, while reinforcing the evidence that links yogurt consumption to a reduced risk of diabetes. It is important to note that all supporting evidence for the FDA's claim is derived from observational studies, which cannot establish causality. Furthermore, no randomized controlled trials have directly demonstrated the impact of conventional yogurt on diabetes incidence. The FDA has also cautioned against the use of this claim for high-sugar yogurts, although specific fat or sugar thresholds have not been enforced. Lastly, it is worth mentioning that Danone North America funded the symposium and article from which this information is derived, and several authors are affiliated with Danone, the National Dairy Council, or the International Food Information Council. What do you think? As we consider the implications of these findings, it raises an important question. Should we be more proactive in incorporating yogurt into our diets as a preventive measure against type 2 diabetes? Or do you believe that the focus should remain on broader lifestyle changes? Share your thoughts in the comments below.